I decided to get a Galderma aesthetic treatment because it was my time. I started looking in the mirror and quite couldn't figure out who was looking back at me. There was someone else that was a little older than I felt.
I was really unsatisfied with the lines that I had on my face. I felt they made me look tired all the time. And I'm getting married in June and I just want to have the most perfect wedding pictures, and I thought that would help.
I'm 45, almost 46, and I just can't believe that I'm that old sometimes.
So I was turning 50 and recently single and wanted to feel pretty again.
I've just entered my 7th decade and I was feeling really good, but noticing some fine lines.
The lines here on my face, it made me feel very drawn. My cheeks had fallen a little bit.
And I just started to notice a lot of asymmetry in my lips. So I thought, well, there's something I can do about this.
Prior to my Galderma treatment, I had a few concerns. My daughter had brought up the fact that it might not be safe.
I really didn't want to look like a duck, or I didn't want it to be noticeable.
But I was really skeptical. I'm not someone that goes and does those kind of things. Galderma, to me, when I went online, was a very reputable company. They had a long reputation of working with people.
The doctor definitely squashed all my fears and made me feel very comfortable having it done.
It was a very quick procedure.
Wasn't anywhere near as painful as I thought it would be.
After 2 days, I could start seeing a difference and felt really good about it.
It was pretty minor and it really made a big difference.
Now that I've had the Galderma procedure, I'm so much happier. Not that I wasn't happy before, but I guess I was just feeling like I was getting older. Now I feel who I am inside. I'm young at heart.
I love my Galderma results. I feel like it's subtle enough that I notice the difference and it makes me feel pretty.
I feel like my lips look more even, that it took away the fine lines, and it's not just younger, it's better.
My cheekbones, they are fuller, they're more defined, and you put a little bit of blush or anything on to enhance them, and it's amazing the difference that it makes in my face.
Family members have noticed, and I've had several friends comment that they can see a difference.
Nothing was fake. Nothing looked like it had been done.
It has made me feel more confident in my life, not only with work, but in my personal life.
I would recommend it to a friend.
Be prepared to really love the way you look afterwards.
I would do it again in a heartbeat.
I am so happy with the results. I'm going to be the best person that I can be and the best looking Robin that I can be on my wedding day.
A new survey finds that women across the generations experience a disconnect between how young they feel and how old they look. More than 80% of women in the survey say their faces show signs of aging. Changes in the underlying structure of the face are the main culprits in facial aging. These are the changes that cause women to look into the mirror and see an image they no longer consider youthful. You can see the effects of aging in this 50-something mother and her 20-something daughter during routine facial assessments by specialists. Notice how different areas of the face change with age because of bone loss, fat redistribution, and loss of collagen. The younger face appears almost as a single structure, with smooth facial contours and very little shadowing between the various areas of the face. With aging, changes in both surface and subsurface structures of the face cause separation of these areas. In normal ambient light, age brings undesirable shadows that appear at various locations on the face. The goal of aesthetic correction is to help individuals be the best version of themselves with a youthful, natural-looking result over time. Conversations about aging need to be more than skin deep. Talk with your trusted specialist about having a facial assessment to develop your plan for natural-looking results and a more youthful appearance. Download the Ageless Face Visualizer app from iTunes to see different Galderma treatment options for you. And join Aspire Galderma Rewards today to earn exclusive rewards, bonuses, and discounts so you can feel good about looking your best.
Today is all about stopping those medical problems before they start. And our next guest is Ming. She has a couple of sunspots on her face that she's worried about. So Dr. Orton is going to remove them along with physician assistant Tiffany. And we're wearing these funky glasses because this laser is one you don't want to stare into, right, Drew?
That's right. You're testing me, Travis. The question is, can I laser and talk at the same time? Well, I think the answer is yes. So this is a IPL intense pulse light therapy from our friends at Alma Laser. It's not ablative laser. It's not like CO2 or erbium laser, which we've done before on the show, specifically for brown spots, call them sunspots, age spots. We can nip these in the bud now, lighten them. She's going to need a number of treatments, probably anywhere from 4 to 7 treatments. We space those over every 2 weeks. And the other thing is that some of these lesions actually can be precancerous lesions. So by treating them now, there is a chance that you're reducing the risk of skin cancer later. So how are you feeling, Ming?
I'm feeling great.
So Ming, these spots have been getting bigger over time?
I've always had freckles, and that's fine. I like my freckles. But in the last 5 years, a couple of the freckles have gotten bigger and bigger, especially on the side of my cheek. And
all right, we're going to be by your nose. So you just feel a little pinch here, don't you?
Mm-hmm. It doesn't hurt.
And I want you to see this now, that you can see that you get some discoloration in there. You can see that the energy has been picked up in those brown spots. You see that a little bit? That's what you expect to see now. That means that she's absorbed that energy. You're actually blowing up, exploding those brown spots with the intense pulse light treatment.
And one of the things that you said that's so very key here is, obviously as we age, we get age spots, especially if we have more exposure to the sun. But let's talk real quickly about when it can become a true problem.
And we talked about it so much on the show. Get to know your moles, of certain signs that you need to look for with any type of moles, pigmented lesions on your face, on your body. You need to have those checked once a year by your dermatologist. Keep an eye on your moles, get to know your moles.
And we'll actually have a link on our website, thedoctorstv.com, all about the ABCDs of moles. And Ming, take your glasses off. I want to show you some before and after, or before and after. Is this someone who's had the treatment, Drew?
Yes, these are before and after shots of similar patients that have had the Harmony laser treatment, have gone through the whole series. I mean, this is significant sun damage, aging spots on the left, and you can see how well this works with a number of treatments.
Sound good?
Looks good.
Are you up for that?
I'm excited.
And this is something that is available across the country?
Pretty much most dermatologists, a lot of plastic surgeons. I have this in the Beverly Hills office at our Rock Spa, and also in my Rancho Mirage office. Simple to do, easy to do.
I can
be good for you too.
Well, Ming, thank you, and good luck with these.
Thank you.
Tiffany, thank
you. Have you heard? For the first time ever, there's an injectable treatment for moderate to severe fat below the chin. The best part? It can be administered by your doctor right here in our office. The injection procedure takes 15 to 20 minutes, and it doesn't require any surgery. Kybella deoxycholic acid injection is a first-of-its-kind injectable treatment that reduces fat under the chin or submental fullness for a contoured profile. No surgery required. Submental fullness can impact a broad range of adults, including both men and women. So, what causes submental fullness? Submental fullness can be caused by a variety of factors. Sometimes, even with diet or exercise, submental fullness may not go away. According to a 2015 survey conducted by the American Society for Dermatologic Surgery, 67% of people said they're bothered by submental fullness. If you're one of the many people bothered by submental fullness, ask your doctor if Kybella is right for you. Kybella is a series of injectable treatments tailored by you and your doctor to gradually improve your chin profile. Up to 6 sessions spaced at least 1 month apart may be needed. So, how does Kybella work? Kybella is a non-human and non-animal formulation of deoxycholic acid, a naturally occurring molecule in the body that aids in the breakdown and absorption of dietary fat. When injected under your chin, Kybella destroys fat cells, and once those cells are destroyed, they can no longer store or accumulate fat. The results of Kybella speak for themselves. In clinical studies, 79% of people treated with Kybella had improved satisfaction with the appearance of the area beneath their chin, compared with 34% of people treated with placebo, 12 weeks after last treatment. Kybella patients reported improvement in the visual and emotional impact of submental fat when asked how happy, bothered, self-conscious, embarrassed, old, and overweight they felt with respect to the amount of their submental fat after they received treatment. According to one Kybella patient,
I consider myself a pretty confident person, but one of my main insecurities had always been my double chin.
Another Kybella patient tells us, I've always been at a healthy weight. I tried exercising, but it didn't matter what I did. I still had a double chin. With Kybella, I don't feel like I'm trying to hide something anymore. If you're bothered by fullness under the chin, whether it's moderate or severe, you don't want to get surgery, you feel your double chin makes you look older or heavier than you actually are, or you eat well and exercise, but submental fullness does not go away, Kybella may be right for you. Only your doctor can determine if you're a candidate for Kybella. You should not receive Kybella if you have an infection in the treatment area or have had or have trouble swallowing. Kybella can cause serious side effects, including nerve injury in the jaw, which can cause an uneven smile or facial muscle weakness, and trouble swallowing. The most common side effects of Kybella occur in the treatment area and include swelling, bruising, pain, numbness, redness, and areas of hardness. Interested? Talk to your doctor about Kybella today. Important safety information about Kybella. Kybella is a prescription medicine used in adults to improve the appearance and profile of moderate to severe fat below the chin, submental fat, also called double chin. It is not known if Kybella is safe and effective for use outside of the submental area or in patients under the age of 18. You should not receive Kybella if you have an infection in the treatment area. Before receiving Kybella, tell your healthcare provider about all of your medical conditions, including if you have had or plan to have surgery on your face, neck, or chin, have had cosmetic treatments on your face, neck, or chin, have had or have medical conditions in or near the neck area, have had or have trouble swallowing, have bleeding problems, are pregnant or plan to become pregnant, it is not known if Kybella will harm your unborn baby, are breastfeeding or plan to breastfeed, it is not known if Kybella passes into your breast milk, talk to your healthcare provider about the best way to feed your baby if you receive Kybella. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Especially tell your healthcare provider if you take a medicine that prevents the clotting of your blood, antiplatelet or anticoagulant medicine. Kybella can cause serious side effects, including nerve injury in the jaw, which can cause an uneven smile or facial muscle weakness, and trouble swallowing. The most common side effects of Kybella include swelling, bruising, pain, numbness, redness, and areas of hardness in the treatment area. These are not all of the possible side effects of Kybella. Talk to your healthcare provider for medical advice about side effects. For more information, please talk to your healthcare provider or see full prescribing information in our brochure or on our website at www.mykybella.com.
Sculptra Aesthetic should be injected into the deep dermis and gives the appearance of an immediate correction of the defect. Massage is an important part of post-treatment care. Massage at the injection site will allow for a more even distribution of PLLA. Within days, the aqueous components of Sculptra Aesthetic are absorbed and natural swelling resolves, resulting in the temporary reappearance of the defect. But microparticles of PLLA, the main component of Sculptra Aesthetic, begin working within the deep dermis to replace lost collagen and reinforce skin structure. As microparticles of PLLA are absorbed, a collagen framework is provided to gradually restore volume. This results in the smoothing out of shallow to deep nasolabial fold contour deficiencies and other facial wrinkles in which the deep dermal grid pattern crosshatch injection technique is appropriate, and which can result in a more refined appearance that can last up to 2 years. In time, it is theorized that an increase in collagen deposition occurs, correcting structural deficiencies caused by collagen loss and fat atrophy.
therapy is completely unique in the fact that we can actually create that thermal response in tissue that we're looking for non-invasively at layers that a cosmetic surgeon likes to operate at when they're doing a facelift. Ultrasound can get to the deep parts of your skin layers without disrupting the surface. That ultrasound therapy goes below the surface of your skin to actually heat the tissue and create this response that generates new collagen and elastin.
I am thrilled that I did the Ultherapy treatment. When I look in the mirror, I feel like I look younger and better. I will say though that I noticed immediately the results. I went back to work right after the procedure, and one of the girls who sits near me said, "Did you get a nap at lunch?"
I am over 50 years old currently, and every year I have the same thought. I want to be 50 and fabulous. I want to be the best me that I can be at the age I am today. And I also want to do it with non-surgical intervention. So when Ultherapy hit the market, I did my research, and I thought, if this treatment works, this is exactly what I need.
Like many people, I just have a fear of surgery, and I chose to go ahead and do this as an alternative to surgery. I was expecting to have downtime and recovery or what have you, but there was no downtime or discomfort whatsoever afterwards.
After I had Ultherapy done, the number one thing that people would say to me out in public is, "You've lost weight, haven't you?" And I hadn't lost any weight, you know, so they were saying that because I think my face looked a little bit more toned. It had a lift to it. You should consider Ultherapy as a man because it makes you feel good. If you feel good, you go out and perform better. It's been taught through sports, it's been taught through competition, it's been taught in our society forever. There's no reason women should be the only ones to always feel good.
Initially, and it was almost instantly, there was honestly this lifted, smoother, tighter feeling to my skin and the way I looked. I had great lift on my eyelids, and I think that as time goes on, I've noticed like a smoothing out of my skin.
For me, it's all about looking natural. After my treatment, wow, I have an eyelid, and it looked good. And I noticed that as the weeks went on, the results just got better and better and better. It's something that's natural, which is what I like.
Algo que me influenció en mi decisión de tener Ultherapy es el hecho de que yo tengo 40 y pico años y realmente por dentro me siento como una persona de 33 años. Así que yo quería que mi cara muestra mis sentimientos por dentro. Los resultados que he visto es que siento que la cara está más apretada, la piel está más apretada. Me siento que la apariencia de mi piel se ve más joven y de hecho me siento que tengo más confianza.
수술하고 달리 울세라는 갑자기 변화가 일어나진 않지만 제가 제 경험상으로도 매일 아침 조금씩 변하는 게 느껴졌고 수개월 후에는 친구분들, 지인들도 제 얼굴을 보고 많이 얘기해 주셨고 저도 거울 볼 때마다 상당히 만족했었습니다.
A very important part for me in my physics, it's my décolletage because I only wear V-neck. It's as important for me as my face or my nose. I didn't want not to be able to wear V-neck at one point because my skin would look too old or that it would look strange.
special report, Wrinkle Rehab. This is where we explore the newest anti-aging therapies. And a star of The Real Housewives of New Jersey is trying an innovative new way to tone and tighten her skin and look years younger without surgery.
Ultherapy uses ultrasound to lift, tone, and tighten loose skin. Dr. William Song, here with another patient, says this is one of his favorite anti-aging therapies because there's zero downtime.
What kind of results do you see?
We're seeing a lift. We're seeing firming of the skin. It's more like turning back the clock.
Did it really make a difference?
It really did. I mean, I can tell a lift here.
Here is Jacqueline before, and this is after. But the results weren't instant.
Over, 3 to 6 months, it just gradually gets tighter and more tone.
Now, Entertainment Tonight, the worldwide leader in entertainment news.
And have you seen how terrific Courtney Cox looks these days? Well, let's get started with Courtney's beauty secret revealed.
90% of the time, I'm just such a positive person.
She may be labeled a cougar on TV, but in real life, Courtney Cox sure doesn't look like a woman about to turn 50. In part, that's because Cox has admitted to undergoing Ultherapy. No knives, no lasers. Ultherapy uses ultrasound technology to stimulate collagen production, which tightens the skin. From her friend's days to now, look at how the skin around her neck stays tight.
Here at Roxpa, we're seeing a huge demand for Ultherapy, especially moving into award season. This is a great treatment that is minimally invasive, minimal discomfort, and is something that you can do and be red carpet ready within a week.
Board-certified plastic and reconstructive surgeon Dr. Kevin Brenner says Ultherapy is great for people who don't need a facelift just yet.
Ultherapy you do once, and you start seeing results about 2 weeks after the treatment, and that results actually improve over approximately 3 to 6 months following the treatment.
The procedure takes just about an hour, may cause some redness, and cost between $2,500 and $3,500. Courtney admitted to trying Ultherapy, telling New You magazine, "You know what? I'm game for anything. I'm very open to trying to prolong the inevitable."
Tonight on 2020, The Cutting Edge.
Good evening. Never has the phrase out with the old, in with the new had truer meaning than tonight. And not just new, but radically new. The most cutting-edge procedures that often don't involve any cutting at all. 48-year-old Cherie Bowman has never had any cosmetic procedures.
I never actually ever went for even a facial.
Between the children and her work as a relationship coach, Cherie never had time for herself until now. Using a new device that delivers heat to shrink the tissue under the skin.
That feel okay? It's not a laser. It uses ultrasound, but not the kind of ultrasound you had during pregnancy. This is high-density focused ultrasound that delivers heat very deep, and that over time will give her a lift, both of the upper and the lower face.
3 weeks after her visit with Dr. Day, Cherie Bowman is getting used to her new face.
Before I noticed I'd have to pick my eyelid up to put the eyeliner on, and I don't have to do that anymore.
If you have all these treatments, does this mean that you will never look old?
Well, it may not be that you never look old, but we can slow that process down in a very natural way with these procedures.
So right now we're finding out the latest skin tightening tricks and slimming procedures without surgery from cosmetic dermatologist to the stars, Dr. Frederick Brandt.
So many patients don't want surgery, they don't want the downtime, or for medical reasons they can't. And Diane's been a patient of mine for a long time, and here we're using the same ultrasound energy, but instead of targeting fat, we're heating the deeper layers of the skin and the subcutaneous tissue. And you can see I'm applying the ultrasound, and it's very safe. There's a screen back there which shows the levels of the skin you're heating. And we're doing this procedure on the neck. It's going to take about a half an hour.
Okay. You obviously feel that it's worth it, right?
Absolutely.
Hundreds of thousands of people undergo liposuction every year, but some
Relatively new treatments claim to remove fat without surgery. We wanted to know whether they actually work, so we asked Vanita Nair to look into one of them. Vanita, I know nothing, but sign me up.
That's sort of how I felt. Good morning to you, Gail. Well, this is one of the rare medical stories where all the academics that we spoke to agreed that the procedure works if it is used on the right patient. The basic idea for cool sculpting, that's what it's called, stems from kids who routinely ate popsicles. Doctors noticed they grew up to be adults with dimples because the cold was killing the fat cells in their cheeks. So now doctors are applying that principle to other parts of the body. If you've ever seen before and after pictures following a fat removal procedure, then these are not that surprising. But when you hear the fat was removed after just 4 treatments without using a knife or a needle, these results are unprecedented. I so badly want to believe this works.
Well, I think it's the most proven technology.
Dr. Neil Sadik, a professor at Weill Cornell Medical College, says the procedure is called cool sculpting. It was created by 2 Harvard doctors, and as of last month, it's been cleared by the FDA for treating a patient's thighs, love handles, and belly.
I feel a major vacuum.
That's where 33-year-old Melissa Allerton, a yoga teacher and private chef, was being treated while we watched.
Does it feel like ice?
Yeah. It does, like a thin sheet of ice.
The process of cool sculpting feels like ice because this device is freezing the fat cells directly below it. Once they're frozen, the fat cells drain naturally from the body. It can take 6 to 12 weeks to see the results, but a patient can lose half an inch from their waistline after just one 1-hour treatment. An area can be treated multiple times, but Dr. Sadik says the first treatment is usually the most effective.
These techniques are not substitutes for liposuction. They're not for people that have large amounts of fats that need to be removed.
Are there any side effects?
The only real temporary side effects, you can occasionally get a little bit of bruising. You can get a little bit of redness.
The latest report by the International Society of Aesthetic Plastic Surgeons shows the U.S. is the leading country for surgical cosmetic procedures with more than 1 million performed every year. That includes about 110,000 tummy tucks and 220,000 liposuctions. Worldwide, 425,000 cool sculpting treatments were performed last year alone.
What are your hopes after this?
But it'll be able to be a little 4-pack this year and not just a 2-pack.
Allerton says she was drawn to the procedure because it's so minimal she can teach a yoga class later today. Other doctors we spoke to that had no financial relationship to the product say there is still no magic pill for weight loss, but they all agreed that for the right patient, cool sculpting works.
While the fat cells that are treated drain from the body, there are still other surrounding fat cells that can expand, so a patient has to maintain a healthy diet as well as some exercise. As for the cost, one abdominal treatment is about $1,300, and each love handle is about $800.
So tell Dr. Rose you're ready for this.
Yes, Dr. Rose, I am ready. Going to go put some popsicles on my butt. I would so do that. I'm not kidding. I'm not trying to be funny. I would do that. You don't have to have surgery. Yeah. I'm in.
Tonight, tomorrow night, the next night?
Yes. I'm going to be busy this weekend, Charlie.
Yes, what are you doing this weekend, Gail?
Hanging out with some popsicles.
Yes. That's what I'm doing. That's what I'm doing. Laugh if you want to.
That's exactly right.
I want to go down a dress size. Just saying.
No, I'm laughing because of the popsicles comment. I'm laughing at the popsicles comment. Vanita, that was awesome. Thank you. Definitely the highest rated segment of our show.